It's Thursday, November 12th, and this is now on HNN.
Big decisions that could impact the future of Honolulu's embattled rail project are being discussed today.
President-elect Joe Biden is moving forward, naming his White House chief of staff. I'm Skyler Henry with a look at the move and how President Trump is still contesting the election results.
After being shut down for about 8 months, the popular farmers market at Kapiolani Community College is getting ready to reopen.
Plus, the Stan Sheriff Center is getting a new name. These stories and more coming up on This Is Now. Good afternoon, everyone, and welcome inside another episode of This Is Now. Ian Sharing along with Ashley Nagaoka. Just a heads up, we are awaiting a mayoral press conference on the coronavirus pandemic within the next half hour. We'll bring that to you when it happens. But first, the future of Honolulu's rail project was being discussed today.
That's right. The HART board is having a meeting today, and CEO Andy Robbins is laying out his vision to complete the project after the city pulled out of negotiations for a P3, or a public-private partnership, to finish the final leg of the project as well as operate the system. Now, here's HNN Managing Editor Daryl Huff with more on what could be discussed today.
So this is a really important meeting for HART because for weeks now, it's been clear that the big P3, the public-private partnership, has been a complete flop. It did not work. The bids came in way too high, apparently, and it would burden the next mayor, the next council forever, for 30 years with high operating costs, and it wasn't even clear that the construction of the last few miles would have been affordable. So what's been happening was the mayor, pulled out of the negotiation, said, this is a failure. We need to go to plan B. But the CEO of HART, Andrew Robbins, said, no, let me talk to these guys. We'll talk to the bidders. We'll try and work out something, clearly not what was envisioned, but maybe these guys, they've done a lot of research. They know the route. They know a lot of stuff that we may not even know about what's ahead. So let's work with their expertise, right? But he's been under a lot of pressure because in just a couple of months, we lose like $250 million in federal funds. So there's this time pressure going on. At the same time, there's this high level negotiation that's all in secret. So the problem is the HART board is practically ready to fire Robbins over all this because it's all been in secret. Even the mayor doesn't know what these bids look like. The board doesn't know what these bids look like. It's all just this Robbins and these bidders. So they've been putting a lot of pressure on him. Last week, they came one vote short of forcing him to just cancel the whole thing and move on. Canceling the whole thing would mean that all of a sudden it becomes public and we learn all that we can about what these bidders are willing to do, cost factors that other people might not have figured out, and so on. The mayor wants that so that he can then make a proposal and they can work out a new plan B. So today on the agenda is Robbins presents his alternatives to the P3, but that's all it says. So far, nothing's been posted. We don't know what he's going to say. It's scheduled for midday. These meetings can last a long time. So we really don't know what's going to happen, but the pressure is on for him to walk away from this bid and help the mayor and the city move on to a plan B.
Is Robbins' future going to be discussed in this meeting as well?
That's on the agenda. It's been on the agenda for a while. Like the agenda reads something like, a succession plan, which that's a writing on the wall if ever there was one. But if he wants to stay on this project, he's going to need to learn how to play ball with the rest of the city and with his own board, because clearly they came within one vote. And the only reason they came within one vote is because HART is so screwed up now by the charter amendment that added a bunch of people to it who can't vote. And so you have this big board, you need X amount of majority of the board to vote on something to get something done, but they don't have enough voting members to reach that majority except if it's completely unanimous. So one person disagreeing with the rest makes it unable to do anything. So it's just a really, You know, I won't use the military term that situation normal, all fouled up. That's what it feels like right now. So this could be a very important meeting, or we could just end up in turmoil again.
All right, Darrell Huff, thanks for joining us. Ian, we're going to send it over to you.
President-elect Joe Biden has picked the man he wants to be his chief of staff in the White House, and it's someone the former vice president is already very familiar with. Skylar Henry has more from the White House.
President-elect Joe Biden has chosen Ron Klain to be his chief of staff. Klain brings years of Washington, D.C. experience, including serving as Mr. Biden's first vice presidential chief of staff. The pick also shows the emphasis the president-elect is placing on the pandemic response. Klain has public health experience after serving as the Ebola response coordinator during the 2014 outbreak.
We need to be masking, social distancing, remaining 6 feet apart.
Dr. Celine Gounder sits on President-elect Biden's coronavirus advisory board. She downplayed the need for another full lockdown during an interview with CBS This Morning.
What we need to be tightening up right now is indoor dining, going to bars, indoor gyms, that sort of thing.
President Trump continues to claim via Twitter that he will win the presidential election in the end. CBS News did call Alaska and its 3 electoral college votes for the president Wednesday. This morning, the president tweeted, "It took long enough." And he added, "Now with a recount, we will win Georgia also." Georgia Secretary of State Brad Raffensperger told CBS This Morning that the recount is unlikely to change the 14,000 vote lead President-elect Biden currently holds.
At the end of the day, I think you'll find that when we do the hand recount of all the votes, it'll substantiate what we've gotten with the electronic ballot counting with the machines.
The Trump campaign has yet to produce any evidence of widespread fraud, which would change the outcome of the election. Skylar Henry, CBS News, the White House.
We're going to get to the end of the Lanai lockdown in just a moment, but nationally, the coronavirus pandemic is showing no signs of slowing down. Yesterday, the U.S. saw another day of record-breaking infections. David Begnaud has more.
The coronavirus pandemic continues to accelerate at a record-shattering pace. As the White House remains silent, governors are taking action, reimposing restrictions and urging residents to get back to the basics. Governors like Indiana Republican Eric Holcomb.
I'll sign an executive order that will implement pandemic requirements for all Hoosiers.
His neighbor to the east, Ohio Republican Governor Mike DeWine, warned that businesses could be forced to close if infections continue to spike.
It's advancing quickly and seeking victims in every community in Ohio. If you don't know any of its victims yet, sadly, I suspect you will.
And it is scenes like this, students rushing the field after Notre Dame upset Clemson last Saturday, that have renewed concern about spread on college campuses. Now, the university is mandating that all students get tested before they go home.
So we are all receiving exit testing before we leave, and if we do not get exit tested, then there will be holds placed on our registration so that we can't get ready for classes to come back for next semester.
Other universities have announced similar plans for mandatory exit testing and are not bringing back students until next year.
We realized that was going to be extremely dangerous because everybody leaving, coming back, there was bound to be a massive spike of the virus when they got back.
So the CDC is offering this guidance to Americans for Thanksgiving. You should limit your gatherings to members of your household, no one outside. Specifically, the CDC says college students who are away at school should not be considered members of the household. But if they're going to come home, the CDC says socially distance everyone inside the home. 6 feet apart, if you can, 6 feet apart from members who are not of your household. Everybody should be wearing a mask. And keep the windows open. David Begnaud, CBS News, South Bend, Indiana.
Back here at home, the island-wide lockdown on Lanai has been lifted. Residents have transitioned from a stay-at-home order to a safer-at-home order after an outbreak of coronavirus cases last month. It's been 6 days since the island's last confirmed infection. Lanai only has about 3,000 residents, but recorded a total of 106 cases and 3 hospitalizations. Last night, island leaders held a Zoom meeting for community members to answer questions, but some residents say they're still confused over the rules.
Really wanting clarification on travel. For us, and I had made this suggestion and asked at the end of the meeting if they could come up with some kind of a document, a very simple chart that these are the travel scenarios, this is what you have to do.
The county's website says travelers to Lanai are required to quarantine unless they have a negative COVID test or they're approved for essential work. Lanai residents have to follow the same statewide rules on inter-island travel as everyone else. One exception is that Maui and Molokai residents can travel between the two islands unrestricted.
In all, state officials reported 118 new COVID-19 cases statewide yesterday, with 85 on Oahu and 23 on Hawaii Island. No new deaths were reported, keeping the overall coronavirus death toll at 222. Right now, the 7-day average of cases on Oahu is 81, and the positivity rate is over 3%. The numbers need to drop below 50 cases and 2.5% for 2 consecutive weeks before any more restrictions are eased. The state reopened travel from Japan about a week ago, so we sent Casey Lund to Waikiki to find out more about how the program is working and if it's helping the economy.
Good afternoon. The Sheraton Waikiki is such a hugely popular and beloved property for Japanese tourists, and now that we're 6 days into them being added to the state's pre-travel testing program, the Sheraton opened up this morning at 9 a.m. to allow the first guests back into the hotel since being closed down for months because of the pandemic. They've made some renovations, and of course we talked a lot about that on Sunrise earlier this morning, but we want to talk again about the Japanese travel that's happening right now. Eric Takahata with me from the Hawaii Tourism Authority, Hawaii Tourism Japan. I just want to get an idea of those first few flights. There's only been 3 since November 6th. Tell me about how many people roughly are on those planes.
So the first 3 flights, first one came in on November 6th. We had about 65 passengers on that one. November 7th was the next flight. We had about 120 or so on that one. And then November 10th, about 120 or so on that one as well. So we're seeing it to start to trickle, and the floodgates should be kind of trickling right now.
Yeah, slowly creeping up. I think before we went on camera, we talked about it as a baseball analogy. We're getting on base right now and getting some momentum as we close out 2020. What do you think is the biggest deterrent, and I think I know the answer to this, that's keeping the Japanese from coming to visit right now?
Yeah, so it's that 14-day quarantine that we spoke about. They have to 14-day quarantine when they get back to Japan. And I would say that's the biggest deterrent right now for the Japanese coming to Hawaii. But we see demand building up, so good signs.
And you know, that's when we're talking about good signs of things to come. The Sheraton opening back up, the Royal Hawaiian, the Moana Surfrider just opened back up. We're seeing positive signs of life here in Waikiki. What does the forecast look like for Japanese tourism? It's probably going to be still slow in 2020, but when are we going to start to see some better numbers? You're hoping at least.
So, like you said, we're slowly opening up this year, and we'll probably end up with an additional couple thousand people for this year, for 2020. But for next year, 21, quarter 1, quarter 2, and then especially quarter 3, quarter 4 of 21 is looking really good. So we see a steady ramp up for Q1, Q2 of next year, and then leading into the summer, where we should see significant increases from the Japanese market, Q3, Q4 of next year.
Very good. Eric Takahata with us from Hawaii Tourism Japan. A lot more information on what we covered here on Sunrise at hawaiinewsnow.com. For now, reporting in Waikiki, I'm Casey Lund for This Is Now.
CVS is expanding its free COVID-19 testing in Hawaii. The company is opening 9 more curbside testing sites statewide, 5 on Oahu, 3 on Maui, and 1 on the Big Island. The sites will be located at CVS Long's pharmacy locations, and the tests will be self-administered PCR tests. The tests are free for those who meet CDC testing criteria, which includes having symptoms or being exposed to someone with the virus. Most results will be available within 2 to 3 days.
It's been closed since March, but the KCC Farmers Market makes its long-awaited return this weekend. Billy V has more.
Thank you very much, and that's good news for a lot of people, not only the people that would come on Saturday and enjoy, but also the farmers as well. We're talking in the story with Megan Kono, who's with the Hawaii Farm Bureau. Like I said, farmers got to be happy about this.
Yes, we're so excited to be back this Saturday, November 14th at the Kapiolani Community College.
Okay, so first of all, tell us how many people or vendors that you had from the past are going to be part of it now.
Yeah, so we're going to get back around 90 to 95% of our vendors. That's about 60 plus vendors.
That's
for
amazing.
Saturday. Yeah.
Okay, you're not in the same place. We're here over one parking lot over, so this is where you're going to be temporarily, or?
Yeah, I mean, from here on out, we should be here. Things may change, but for the most part, in parking lot B.
Okay, so it used to kind of wind around down in the lower parking lot. Here it's very straight line, so there's lots of room and lots of spacing as well.
Yeah.
Let's talk about the live goodies that we have here. First of all, we'll start with this end of the table. Mangoes are not in season, right?
Mango, this is pretty late in the season, and surprisingly, we have a lot of nice big Raposa mangoes coming in.
That's awesome.
Yeah.
What is this right here?
That is honeycomb. So people usually chew on this like candy.
Sorry about that, Billy. We're going to dip into Mayor Caldwell's presser now. They are at a clinic at Kokua Kilihi Valley talking about the city's response to the virus. Let's listen in.
The health of our community would not be sufficiently cared for. And so it's a real honor to stand here in Kokua Kilihi Valley with Executive Director David Daroff, who's going to be talking about initiatives that we're launching to really help those who need the help the most get the care they need as we face the challenges of this COVID-19 pandemic. We're here today to announce a partnership between our 7 community health centers and the Hawaii Primary Care Association that helps manage and work with our community health centers. What we're talking about in this partnership is providing funding of up to $10 million for our community health centers to do more than what they're doing today. And they're doing a lot with very little. One is they're going to provide free COVID testing to everyone who wants it and needs it. They're going to provide contact tracing. They're going to do their own contact tracing in their communities, which I believe is going to be more effective than the Department of Health contact tracing, not for bad reasons, but the health centers have built a level of trust, a relationship with their communities, and that's going to make a difference in terms of answering a phone call and talking about who you came into contact with, so we can find everyone who may be exposed to the virus and making sure, and this is the third point, that they get the isolation that they need safely. And we have people here to talk about that today. And what's going to make a difference now is that there's going to be a healthcare navigator at these health centers that will help those who come in to be tested, who are tested positive and need help in finding quarantine, to help them navigate this very challenging thing. I think about any of us, me as mayor, if I tested positive, what does that mean to me? Would I feel shame? Would I feel worried? Am I going to get really sick? And then I think next, what about my wife? What about my daughter? What about my workers at the city hall that I come into contact with? And where am I going to go to not get others infected? Now that's for me as mayor. Think if you're a Pacific Islander living in Kuhio Park Terrace, 10 or 15 together in 2 bedrooms, and you have all these challenges plus a lot more. It becomes extremely difficult. And I believe that these navigators are going to help hold hands and build bridges to get people the protection and support they need. And it's not just support services through the navigator, but it's also financial aid. Because if you're the income earner for your very large family and you test positive and you can't quarantine safely in your home, and you're offered a hotel room in Waikiki, and they're nice rooms with unobstructed views of Diamond Head and Waikiki, but you're leaving your family and they depend on you for financial support to put the food on their table, to pay their rent and other things, you're going to be really scared. And so financial support and aid is extremely important to getting these people, these earners, the support they need so they can leave their family and being quarantined safely. these support services are not just about the patient who tests positive, it's about their family. It's about their community. It's about their surrounding neighbors, and how do we take care of all of them? You know, to fight this virus, and we need to fight it until there's a vaccine and it's distributed widely around our island, we got to continue to work together. And this new initiative, using a navigator with financial aid, is going to make a tremendous difference. You know, I think about Kokua, Kalihi Valley, and all our community health centers. They've been on the front line of fighting this pandemic since March. The doctors, the nurses, the other healthcare professionals who work here, their caregivers, and their community. And they haven't stopped. They haven't stopped. They continue to fight. So with this, I do want to thank the Executive Director of Kokua, Kalihi Valley, Dr. David Daroff, for his efforts, but also ask him to come up here and say a few words. And right now, as you can see in Kokua, Kalihi Valley, you do everything, including unplugging the air conditioning units so it's a little quieter, or the fans. So Dr. Daroff, thank you for allowing us to come here, and thank you for all you've done for your community.
Aloha, thank you for joining us here in the Nakoa Clinic. This is how we do things in Kalihi. We use what we have. This was a parking lot. March rolled along and we saw this pandemic coming our way. It didn't take a lot to guess that Kalihi was going to be one of those areas that was most impacted, and surely enough this summer we saw that. This is the center of the storm for Hawaii for COVID, but this space quickly became our testing and treatment facility for people affected by this pandemic in Hawaii. So welcome to Nakoa. I want to thank the mayor and his team for being here today, but more importantly for being here for the community health centers during the course of the last 7 months of this pandemic. You know, we know something in Hawaii, and that is that we can do this. We are doing it. We should be proud of how well we're doing in Hawaii. We can only do that well through a close partnership. We have the city here represented today. We are Oceania's here represented today. I'm sorry that I don't see anyone from the Department of Health, excuse me, but they're clearly an important partner with us. It's only through a careful partnership that this work can happen, and it is happening now. But we have to keep it up, as the mayor just said. I want to reiterate a few things that the mayor said. The mantra for COVID in terms of good care has been test. Got to get the right people tested. We got to have timely tests. We have to have accurate tests. We're doing that in Hawaii. Hawaii has done a better job with rapid turnaround of testing than almost anywhere in the United States. That's other partners, our laboratories here.
And this is a live press conference with Mayor Caldwell and his partners. They're talking about a new partnership with these 7 community health centers. He says they're going to be spending $10 million for things like free COVID testing and contact tracing.
Our viewers on KHNL, we are going to sign off momentarily. If you'd like to continue watching this press conference, we will continue to stream it on Facebook and our digital platforms.
That's going to do it for us on This Is Now. We have a 3 p.m. press conference with Governor Ige. Look for the push alerts on your cell phones.